Assalamualaikum guys, David is here. I'm from Group 2 English for Nursing. Our members are me, David Syahriar Hasby, and then Fery Kurniawan and also Thrisna. Yes, only 3 members. Seems like the chipmunk, right? Okay, in this opportunity, we would like to present our video about physical examination. Check it out. Hello, good morning.
Hello, good morning too.
Okay, first let me introduce myself to you. My name is David. You can call me Nurse David, and I am the nurse in charge in this room right now. I want to ask you some question. Is it okay?
It's okay, Nurse David. What do you want to ask me?
Okay, the first is, what is your name?
Bambang Nurse.
Your full name?
Bambang Toilet Nurse.
Okay, Mr. Bambang, where do you live right now?
Jembrana Bali Nurse.
So, what brings you here?
I want to do a medical check-up, Nurse.
All right, before we start, can you tell me about your medical history and your family's medical history, please?
Let me try to remember it. I think my family and I never get heart sick. Maybe only fever, headache, flu, and etc.
Okay, thank you. Now you can go to the flower room to do medical checkup with Nurse Fery right there.
Thank you, Nurse.
Okay, you're welcome.
First vital sign indicator is blood pressure. Okay, I will start measuring the blood pressures. Alright, let's continue for the next procedure. Now I will take your temperature measurement. I'm using digital thermogun and I'm gonna place it on your forehead. It's okay for you?
Okay, nurse.
Alright, let's wait for a minute. So for the next step, I will do the measurement for your pulse rate and breathing rate. You only need to relax, just breathe normally like the usual. No need to feel nervous, okay? I will measuring your pulse rate via your radial artery in your right.
Hello, good morning.
Hello, good morning too.
Okay, first let me introduce myself to you. My name is David. You can call me Nurse David, and I am the nurse in charge of this room right now. I want to ask you some question. Is it okay?
It's okay, Nurse David. What do you want to ask me?
Okay, thank you. The first is, what is your name?
My name is Bambang Nurse.
Your full name?
Bambang Toilet Nurse.
Okay, Mr. Bambang, where do you live right now?
I live in Jembrana Bali, Nurse.
Jembrana, Bali. So, what brings you here?
I get stomachache.
All right. What is that feel? Does it feels like being prodded by a kind of sharp things like nail, knife, or it feels like being stung by a needle?
It feels like being stung by a needle.
Okay, thank you. And since when did you feel this pain?
Since 2 days ago, Nurse.
Okay, thank you. Let's go to the restroom and I will check you there.
Okay, thank you, Nurse.
Hello, Mr. Bambang. I have introduced myself to you, right?
Okay.
Okay, the next session is I will do the abdominal examination. I'm going to perform inspection first, followed by auscultation, percussion, and then palpation. For this examination, it requires you to open your clothes. Is it okay?
It's okay.
Okay, first I will do the inspection to looking for any lesions, wound, or redness. Fair pigmentation, no lesions, races, or signs of hernia. And then I will auscultate the abdomen area. Okay, this is normal. The next procedure is percussion. Okay, there were no abnormalities found. And the last is palpation. Okay, this is normal and yes, it's clear. Okay, I have finished performing my your abdominal examination, and then all is normal, and I think the problem is what you have eat 2 days ago. You ate the spicy food, haven't you?
Yes, that's right, nurse.
Okay, maybe that's all the examination. You may get out from here if you don't have any question.
Okay, thank you, nurse.
Hello, good morning.
Hello, good morning too.
Okay, first let me introduce myself to you. My name is David. You can call me Nurse David. And I am the nurse in charge of this room right now. I want to ask you some question. Is it okay?
It's okay, Nurse David. What do you want to ask me?
Okay, the first is what is your name?
My name is Bambang, nurse.
Your full name?
Bambang Gintolit, nurse.
Okay, Mr. Bambang. Where do you live right now?
I live in Jembrana, Bali, nurse.
Okay. So what brings you here?
I feel uncomfortable at my right chest.
Your right chest. All right. What is that feel? Does it feel like being brought by a kind of sharp things, like nail, knife, or it feel like being stung by a needle?
It feels like being stung by a needle.
Okay. If I give you scale 1 until 5, what number did you feel?
I think 3, nurse.
Okay, now you can go to the anggrek room and meet with Nurse Adjie.
Thank you, nurse.
Okay, you're welcome.
Good morning, sir. Before we do our physical examination, let me introduce about myself first. My name is Thrisna Adjie, and you can call me Adjie. Okay. Okay, sir. Before we do our assessment, can I know your name? Oh, sorry. Can you repeat it again? Hello. Okay, sir. I want to know about us to you, and what do you feel about your body right now? Okay. Yes, I know. Previously, were you ready to take the exemption? No. And the purpose of physical exemption is to find some problem on your body. The first exemption is palpation. Let me take on your body. After that, I will take percussion on your body. Okay, okay, okay. And the last is auscultation. Let me know. Take a breath, exhale. Take a breath, exhale. Take a breath, exhale. Take a breath, exhale. Okay, sir. All of our exemption have been taken. And please can you go out first and wait for the result. And what therapy is suitable for you. And thank you very much for your cooperation.